Aster Hospital. The concept, let me take 1 minute to explain, 1 or 2 minutes to explain the concept of this panel discussion. So you would have heard about doctors speaking in webinars, talks, health talks, where only a doctor speaks. So we thought when it is a child related topic, why only a pediatrician or a doctor should speak? Child also is a stakeholder, parent also is a stakeholder, and the teacher, right? So the child spends almost 40-50% of the time in school. Teacher is also an important stakeholder in a child's life, or any topic we discuss about child. So that was the idea behind this, and we started this. We had a couple of 2 sessions previously. So this is the third session we are having, and this session we want to discuss about traveling with kids, right? You all might be wondering what is that traveling, right? Everyone travels, but I'm sure those who have kids, they realize the difference between traveling without kids and then with kids. As they have older kids, they have more experience in how to handle it. So we have Vivek Subramaniam here. We have Gayathri S, Ms. Gayathri, she is the coordinator, and we have Dr. Vivekanand Kushtagi, pediatrician. I would like each one of them to introduce themselves. Vivek, please.
Yes, thank you.
As we are spotlighting, we go along with the introduction, Doctor. So first, Mr. Vivek can introduce.
Yes.
Hi. Hello all. Very good evening. Hope everybody can hear me.
Yes.
Okay.
We can hear you.
Okay. Good. Thank you. So a very good evening to one and all present here. Let me just introduce myself. My name is Vivek Subramaniam, and I'm an automobile engineer by profession. And I am out of Bangalore, and I work in the Whitefield area. So basically, I have 2 kids. My elder kid is 9 years, and my younger kid is 3.5 years. So I love to travel a lot, and I have done a lot of travels with my kids till the tip of South India to all over Karnataka. So basically, I would like to give some whatever practices I follow during travel. So this is about myself.
Good.
Dr. Vivekanand.
Hi, I'm Dr. Vivekanand Kushtagi. I'm a consultant pediatrician. I've been practicing for more than 2.5 decades now. My special interest is pediatrics with pediatric gastroenterology, immunology, and infectious diseases. And in this talk, I would like to give input on what are how safe is it to travel, and what are the tips to protect yourself. That's what I would put some inputs today.
Great.
Ms. Gayathri.
Yes, good evening. I'm Mrs. Gayathri. I'm working in ACS Magnolia Mati Public School as a coordinator, and I've been in this profession from past 8 years. So I will share my experience, like how we plan a field trip with the small children and primary school children, and what are the different safety protocols we follow in our school. Thank you.
Okay. Great. I think we have all experts in managing kids at all different levels. So wonderful. So let me tell you what we'll do. Interesting thing is the parent will speak for some time. The teacher will speak. Then our expert pediatrician, Dr. Vivekanand, also will speak about the medical aspect and what all the inputs he can give. We'll have one brief about how safe is it to travel in this COVID times, especially. You all know, like, COVID means just stay home. The ringtone says "Ghar ke bahar mat jao." But yeah, if you have to go out, you have to go out for some reason. So how you can travel, that we'll have at the last. After this discussion, we'll take some questions from the audience. So we have, I can see Ananya, a small child, also attending the session. Very interesting. Let's see any questions from parents at the end of the session, and I'll summarize to have some take home message, right?
Sure.
So here we go. So first question, maybe I'll ask Vivek. So you mentioned that you are a very avid traveler, right? So you have been traveling with your kids.
Yes.
So tell me, how different is it to travel with kids compared to when you're not traveling with the kids, right?
Obviously, Doctor, there is a lot of difference. Before, when you travel with kids, travel is always at a different level, and when you travel alone, you have a lot of flexibility. So obviously, yes, everybody would love to travel with kids, and the first fear that comes in their mind is what would happen if I go out and all those things. So basically, what happens is, as a parent, we have to understand that when you are mature enough to understand that when you travel with kids, you have to forego some of the benefits or some of the entertainment aspects of your travel. Okay, for example, the first thing that comes, I keep it in my mind is always like, I always take it slow and leave a plenty of time. That's the first point. Obviously, you cannot see, I do travel both by roadways and by airways also. So both, I would try to merge both benefits out of it. See, whether it is you traveling by road or you're traveling by a flight, always you have to have adequate time when you're going with kids, because obviously you don't know what you can expect on the way. Like, you have kids will have their breakfast, their lunch, or whatever it is, their tantrums, or whatever you see, their expectations on travel, their changes and their mood changes. So always keep adequate time. And also you have to understand that when you're going to a place, you cannot squeeze in all the places where you see in a day when you have with kids. You have to take it at a leisure pace. Okay. And the second thing that I do is I don't really overpack. Okay. This is the first, when I say overpack is like, say, I don't take care of entire things which a kid needs in the travel. Okay. I only take which is very, very essential, and whatever I can get it at a local place is always available at local place. So I keep it at that place. So it keeps my travel light, and also it keeps me easy for my maneuverability. Okay. Third point is, since my kids are a little older, and I explain them the trip. Okay, so first you have to make kid understand that you're going on a travel. Okay, so they also have a very good understanding, and they will also have a very good expectation of what they can see, what they're going to experience. So basically keep your kids appraised of what you are trying to do. Okay, so during travel, as I said, there are some precautions. As I said, like for example, restrooms, or when you're traveling by road, you have to find restaurants. So it allows you to do your homework little better. You have to be very planned on your approach. You cannot just hop onto your car and start start going towards a destination without having any plans. That you can do when you're traveling alone or with elderly people, but with kids always have to be planned. And second point is in that is like, you have to do your homework very well. When I say homework very well, is you have to find out which restaurants serves food, for example, which suits your kid, and where are the rest stops, where are the washrooms available which are good quality, like which is better for us and safe for us to stop. So these type of basic small things, if you plan, and if you plan exactly in the itinerary, like where are you going to stay, all those stuffs, which hotels are you going to stay, is the hotels kids friendly, does the hotels have a paramedic help, or if there is an emergency doctor available, for example, if something happens. So I plan those trips in such a way that I go to the reputed, very, very known hotels where I can stay, and where I rely on with my past experiences, or through my friends, or now you have the digital, where in the digital world we can discuss, we can look up to a review of a hotel, a lot of stuffs. Okay, so during travel, safety is very important for the kids. Say for example, especially when you are traveling on road, I always encourage kids to use car seats. Okay, I've seen many people keeping their kids in their laps. They keep them lying down in the rear seat of the cars, where if you're an emergency panic braking, where the kids flies out of his seat. So obviously,
someone is unmuted. Mr. Vivek, you continue. I'll mute that person.
Okay. So basically, safety of the kid is very important. I always use car seats for my kid. If I'm traveling in, for example, in a car, suppose if I'm using a flight, I always use a stroller or a sling bag or whatever it is, which keeps you kids safely. The next point is like, kids are also excited to travel. So basically, I usually reward them. Okay. For example, when I'm going to a place, I just you buy them a very, not a costly one or cheap, you buy an item which is very, very available in that, so they also get excited what they get, and so that keeps them motivated during the trips. So this is something which every kid would expect, and as a kid they expect everything that parents would buy, and kids also would also fall into that line where they will know what they would be getting, and what they will do. And second point is like, if I'm traveling for example, if I'm traveling by flight, so I choose the time of the flight in such a way that it doesn't alter any of my kids, either a sleep pattern or a meal pattern or any mid afternoon nap. So basically, an early morning departure, for example, is always best. For me, as I said, it depends on kid to kid. So for me, as I said, I always prefer an early morning departure where my kid would be sleeping at the point of time, and by the time he wakes up or she wakes up, I land in that particular place. And especially when you're traveling by flight, the acoustic pressure differences, obviously, yes, they irritate your kids. So basically, you tend to make them drink water, or you tend to swallow them, make them drink milk, which that swallowing action will ease the pressure out and will help them, and they become less cranky, and they help you and they cooperate for your complete travel. And once I land at the destination, there are some precautions that I take from my end. I don't hop places or hop hotels. For example, I'm traveling to a destination A. I don't keep traveling from A, B, C, D, E, F, and go, because what happens is frequent change of places and frequent change of destinations always unsettles a kid. Okay, because obviously they're kids and they're not used to the environment, and they are also new in learning how the new world that they see along with you. Okay, so basically that is something which I practice. Like, I don't hop hotels or hop places where, for example, I'm in destination A, and after 5 hours or 6 hours I check out and move to a destination B. I don't keep my travel so tight. I always leave a leisure way of traveling, and I always make sure that the kids are safe, and they have their sleep, they have their breakfast or lunch or dinner on time, and they get their type of food which is best available in that particular time. Okay.
Good.
And the last but one least, as people say, one more thing is the safety of the kids. Is one thing is, as a parent, you are also looking at the outside world, and you will get engrossed, and there is a chance that your kid can wander to some other place. So this is something which I have seen in many places where two parents are buying a tickets. Either they buy the tickets and they lose track of the kid. The kid is excited to see, for example, in a railway station, she goes to a stall and your parents are busy buying ticket or showing tickets to the TT, and they wander off. So obviously there should be one person always taking control of the kids always, and one, they should be under the line of visibility of the kids. Kids should be there. And last but not the least, all the medicines, basic medicines. Obviously, yes, you know your kids' history better than anybody else. As a parent, you know what your kids can catch easily. For example, either a cold or a flu or whatever it is. So basically, you should be very well equipped with all the kids' medicines. One latest bottles of all the medicines, like right from cough syrup to fever, all the medicines. Have a handy travel bag for the kid is always mandatory, and that should help them in case they settle down. And also, last but not least, you should be aware of the place where you're going. For example, there are some places which is not kid friendly. For example, you're going for a trek. You can't take a 2-year-old kid for a trek where there is a chance. Okay, so that is something which you have to look out for places where you're traveling, unless it is mandatory that you have to travel. Please, you should always look out for places which are travel friendly, and what access you have around those places. You should be very wary of those situations, and do not change your trip when you're not sure of. Suppose, for example, you're going to a destination and suddenly one fellow says, sir, if you take a detour, there is a very good hill, you can go there and see. Unless you're sure of what you're getting there, I don't do it. I know where I'm going and where I'm coming back from.
Wow.
So the last point.
Wow, Vivek, what a really, I can relate. I think it's like so many tips for the parents who are planning.
There is one
travel.
last tip. I'll tell you
Wonderful.
one last tip. Actually, never get angry on your kid if they create any problems. That's the first and that's the best tip I can give you. Because what happens is, once you start, don't yell at them or don't show your frustration or anger on the kids. Suppose if they are not cooperating with you, please understand, they also need experience and they'll also come up. So this is something which this is the primary tip I'll give you. Never get angry on your kid if they don't match your expectations on the travel. And that's the basic funda.
That's wonderful. That's really wonderful from a very experienced parent, especially who is very avid traveler, right?
Yes.
So I'll summarize these points later, but very good points came up, especially explain the travel to the child and then have an eye on the child. Wonderful. So now I would like to ask Ms. Gayathri about how she manages a trip with kids in the school. It's not 1-2 kids, it's like 20-30 kids. It might be totally different way.
Yes.
Please, madam.
Yes, doctor. I think as a teacher, it is very challengeable to take the children for the field trip, especially when they go with the parents. There will be some control from the parents' perspective. But when we go as a teacher, to some extent, no, we cannot be too strict also. And the children will be very enthusiastic, and they will be waiting for to go to the field trip along with their friends, especially. So to make it as a memorable day for them. So I just wanted to divide this event into 3 stages, like how we start this field trip, how we pre-plan this field trip. As a school, no, we have couple of event organizers who approaches us. And every year, if you see from Magnolia, we plan twice a year to take the children for the field trip. One will be a little fun based, and one will be like educational based. So we have couple of event organizers, and they approach us. So we will tell our requirements, and especially the safety no, is the main motto of our school. So no, when we get and when we finalize, the main thing, the criteria will be it should be safe, eco-friendly to the children, and the distance. Because in our school we take different age group children, like we do take our kindergarten students, we do take our primary students and higher grades. So the distance matters. So accordingly we plan our places. And if necessary, we do also tell our teachers to go and see the place, and to see the amenities, how is it, along with the event organizers. And while deciding the date also, we will make sure that no, the children have next day as a holiday, because the whole day they will be enjoying in their field trip with their friends. No, so we will make sure that the next day will be a holiday. And no, and the next important thing we will make sure is about the transport. The buses what the organizers no, give us, it should be very comfortable for the children, especially for the smaller children like kindergarten, and for the primary kids. And the next important thing to be taken care is about the food, because the whole day we plan, no, especially for the kindergarten as well as for the primary and higher grades, we do plan for a whole day, and the food has to be very clean. And we ensure that they prepare it in their own place and not give any packed food, because the health of the children is very, very important. Okay, so these are the pre-planning stages when we plan for the field trip. So once we plan for the field trip, the next important thing we do is about the consent letter from the parent. We do send a consent circular kind to the parents, stating whether they are interested to send the children with all the details of the field trip, which place we are taking, where we are taking, and what will be the starting time, and which time we will reach. And we will ensure that on that particular day the parents have to come to pick their children on time. So all these things are very much important. So we do ensure that that the parent fill all these concerns, and they say yes, and that yes is very important for us, because we do keep this form as a backup. So this consent letter, we do send it to the parents. And even the major thing is we ask if that particular child is allergic to any particular food, because that also plays a very important role during the field trip, because we don't know which child is sensitive to which type of food. So we do ask them if that particular child is allergic. No, if it is the parents wish, they can send the food to that particular child. Or if they say, tell us if the child is allergic to some food, we definitely arrange for any different no, arrange an alternative food, or we can avoid that particular food for that particular child. So these are the different things we do follow priorly for the field trip. So next main thing is preparing the children. So once we send the circular, obviously they come to know which place we go, and they start planning with the friends, like what we can do on that day, or what things majorly, what food items they wanted to bring and share with them. So no, the main thing we have to ensure that the children's safety is very important. So on the field trip day, like we will guide the children what are the do's and don'ts of that particular field trip. They should not run away, run around like that, or they cannot go anywhere without informing the teacher. So we ensure that they follow in the line. And no, we always divide the students into small groups and allocate teachers, in charge teachers, where one teacher, when during the field trip, one teacher will be following in the front and the other teacher will be following at the backside of the student, so that to ensure that the children doesn't get mixed up in the crowd or doesn't go anywhere out of our control. So we will make sure that the children follow the line and they never go. And we do take our caretakers also. So when suppose the children wanted to use the washroom, especially when we talk to the event organizers, we make sure that the washrooms are maintained very clearly and clean also. And no, we ensure that that particular area has been blocked for our students only for that particular day, so that no, the children, with too much of crowd, the children cannot enjoy. So we ensure that we'll tell the organizers that that particular area has been booked for our school children, so that it would be helpful for us also to maintain no, to keep a track of our children also. And the main thing is that when we take the students for the field trip, each teacher will be having her own no, name list, like which all the children are being allotted to that particular teacher. So whenever we board the bus or whenever we go to that place, whenever we come back, the teacher try to take her count, like a number of students, like she will take the attendance of the students and ensure that her team of students is being back to the bus or back to the place wherever they go. So we tell the students like they cannot go separately anywhere, they have to follow the teacher and they have to go as a team. The next important thing is we take enough first aid boxes. Like if the small children tend to run in the place, they become too much of enthusiastic. So no, we will take enough first aid boxes, and caretakers will be there for the children. Whenever they want to use for the washroom, they definitely go, and we have our own PEs for the for any emergency requirements. And main important thing is we ensure that the children whomever comes for the field trip wears the uniform is a must, because that is a prominent thing where it gives the identification, okay, that child is from no, our school. And if suppose if that child gets missed and he wears his ID card, as you know, each child is being provided with the ID card. So no, if at all he gets missed without the knowledge or something, any teacher whomever is there, because we have ample teachers and more no, PEs and everybody will be there moving around and more vigilant. So no, they can keep a track of the children. And no, we will make sure that the students come in the uniform and ID card. And we make sure that the departure time, the time we start, and the reaching time, we plan in such a way we come back as soon as possible, and we maintain that time, because the kindergarten beyond noon, they cannot withstand because they become very tired. And the same way, when we come back also, we will ensure that we will be back on time. And also we will make sure that the parents come up on time to pick up the children. And the next important thing is whatever the details we have collected, we definitely submit over to the admin department. And our principal also will be keep on touch with us. We keep on be posting about the regular activities and what we are doing, and the children right now where they are doing, and what is been happening. All those updates we will be keep on telling to our principal. So this how we plan our trip, doctor.
That's actually really wonderful. So many new perspectives coming. So maybe,
Yes,
yeah,
doctor.
I'll summarize this points. Very interesting points came up. Now let's hear. See, parents spoke, teachers spoke. Now let's see what the pediatrician would like to advise the parent and teacher, right? When you are taking your kids for travel. Sir, please.
Hi, Vivek and Gayathri. So many new inputs, so many things which I also learned. See, from a doctor's perspective, travel before COVID is different, travel after COVID is different. I would fuse both now. As I was talking to Srinivas, I'll just talk everything and then summarize, and then I'll take a leave of you guys. So before COVID, whenever a patient comes, they tell, sir, can I take my baby somewhere? The first thing is, in pediatrics, it can be a newborn, an infant, a young baby, or an adolescent. Okay. So most of the mothers who come in, they deliver here and they want to take the baby to their mother's place. The first thing they would ask is, can I take my baby to my mother's place? I've delivered here, my mother's there to take care of the baby. So what is the ideal time for them to travel? Ideally, for a newborn, we generally tell after 1 month would be an ideal time to travel, not before 1 month of age. Next would be the route. What would you want to go by plane? Would you want to go by train? Would you want to go by car? Before, we used to tell any modality is fine. Ideally, if a baby is less than 1 month of age, don't travel. After 1 month to 2 months of age, if it is more than 6 to 8 hours, travel with the fastest modality of travel, whichever, either plane. If you can't take a plane, if you don't have a thing, car. So what are the things we generally tell is, whenever you're taking a kid, make sure that whenever you're traveling, make sure you don't have long travels. Always take short breaks. Maybe take once in 2 hours, 3 hours break. That was before COVID. That's all standard. Now, post-COVID, everything changes, So we tell to travel once in 2 hours, 3 hours, take a break and then go. If it's a newborn, make sure the newborn is on the behind seat. Make sure the AC blast doesn't directly fall on the baby. Make sure that your windows are raised and then travel. Ideally speaking, car seat is the thing for any children traveling. But in India, car seat is not compulsory. But what happens is, the kid also behaves how the parents behave, If the father or the mother is putting a car seat belt on, then the parents wouldn't. If you don't wear a seat belt and you ask your kid to wear a seat belt, the kid would not. So we should, as a parent, be an idol to them, make sure that we wear a seat belt and then put a seat belt to them. So the other commonest question what parents ask is, should my baby be in the front seat or the back seat? That's what they would ask. So ideally, a kid more than 13 years of age can always be sitting behind. If it's younger the age, you can make sure that it's sitting front, but it should be supervised. If you're putting your car seat, make sure the car seat is not facing the airbags. It should be away from the airbag. That's very important. And in the West, they use booster seats. In India, we don't use booster seats. So preferably make sure that, since our driving speeds are not high, but now our driving speeds are high, but we always tell, wear a seat belt. That is very important. And distance, as much as possible, keep short distances. That's what we tell. If you want to go by a plane, okay. So plane, the commonest problem which we come across is, whenever they decompress, you have a lot of ear pain. That's the kids who have ear pain when the kids are less than 1 month, 2 months of age. So we generally tell them to either breastfeed during takeoff and landing, breastfeed, or give some local analgesics. So those are basic tips for traveling. 1. 2, emergency kits, very important. As a parent, you should know what are the emergency kits, medicines you have to take. Most of the patients who come in, they ask for an emergency kit for fever, cough, allergies, as food allergies are very common. When you go for a travel, kids have a lot of food allergies. Travel sickness is one of the common things which we come across, where a kid comes, sits in the car, after half an hour, the kid starts vomiting. So what are the first aid for travel sickness? That's what we generally tell. Some kids don't like AC, when the car is full with AC on, they don't want it to be, the AC on, they want the windows to be down. So try to make the travel as more comfortable to the child, and it should be more child friendly. Basically, you're going for a holiday, you're going for fun. It should not be very tight, That's one thing. The emergency kit, definitely what are the things you got to take are the paracetamol for any pain, fever, maybe some antihistamine for allergy, some anti-vomiting medicine. I would always tell a parent, always learn a CPR. Very important. See, for me, my personal experience, my younger daughter, about 2 years back, she was around 9, and we had gone to Africa, and the plane was landing, and she was eating a peanut, and she was in the front seat, I was in the back seat, and during landing she choked. I had to perform a helmix maneuver from behind seat on when the plane was landing, you know. So it was a life-saving maneuver. I was always thinking, if I was not there, what would happen? So these are important things. Like, you know, whenever as a parent, I think they should get trained in some emergency maneuvers, like, you know, when a kid has a convulsion, has a shock. Another experience which I had, this second daughter only, we had gone for a holiday, we were swimming, and there was a live wire next to the swimming pool, and she got out and she started getting electrocuted. So I came running and then had a presence of mind, took up wood and then took her around. So very important is we should have some hands-on experience as a parent, like what happens if we are going for a trek or thing like that, what happens when we have a bite, when we have a snake bite, whatever, a small, I'm not telling major interventions, but emergencies. That's one thing. Now, during COVID, a lot of people ask, can we travel? Is it safe to travel? Can I take my child? So ideally, what I would suggest is, do you think the travel is essential? If you think it is very essential, you can go ahead, but I would suggest not to travel for now, okay? If you travel, go for a shorter distance, make sure you've done your groundwork, make sure that there's not much of caseload around. As you know that everybody is telling the cases have come down, it's not true. The cases are still there. We are seeing a lot of kids with COVID now. So do your homework, make sure that the place where you go, the caseloads are not high. Make sure you select a place where open air is your friend. Make sure that you have a lot of open air. You want to do outdoor holidays are much better than indoor holidays. Make sure the crowds are less. Make sure that, you know, the person who you are going with is vaccinated. Very important. Okay. So anybody you're going with your child, make sure they are vaccinated, so that even if they give, then the amount of viral load on your kid is less. Okay. Make sure without any hesitation, ask them, are they okay to travel? Are they not sick to travel? Very important. Okay. So, and the place where you go, make sure anybody who is serving you, whoever is there, is vaccinated. So the underlying thing is vaccination. Very important. Okay. So masks, definitely yes. Social distancing, definitely yes. Hand sanitization, definitely yes. Okay. So mask, kids about 2 years, we recommend kids about 2 years, but kids less than 2 years would not. So if you are at home, if you are together, most of you, then mask is fine. But somebody new is coming, make sure that you wear a mask. If you think you get exposed, then make sure that you quarantine yourself for definitely 2-3 days. Make sure that you don't feel, if you're not feeling any sickness, then it's fine. Because in children, the disease that comes is generally mild, but we also see severe diseases. So holiday is important, but we should not make sure that us kids should not become sick due to the holiday. Thank you.
Good. Wonderful input, sir. Wonderful. I think each one has given different perspectives. Thank everyone. I think Dr. Vivek has to, he is busy, is leaving. So I really thank Dr. Vivekanand Kushtagi for his wonderful inputs, especially non-COVID travel and now COVID travel, how we can travel. Yes, one important message, ask yourself first, if you need to travel, only then you will travel, and then take all these precautions. Wonderful. So thanks a lot, sir, for all the inputs. So I think we're almost half past. We'll have a small break, right? So we usually follow what we call as a 20-20-20. Anyone knows what is 20-20-20 rule? So it's basically if you're already there on 20 minutes of screen time, right? Yeah, I know we are a bit more than that. So you see something which is 20 feet away from you for 20 seconds, right? This will help you kind of relax your eyes. So yeah, let's do that activity now. I don't want anyone to stare the screen. You all see something very far, 20 feet away for 20 seconds. You can make some strange faces as well as saying, let's start now, 20 seconds. Mayur will tell us the time.
I'm a hot air balloon that could go to space with the air like I don't care, baby, by the way. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Clap along if you feel like that's what you want to do.
Done,
Wow.
sir. Done.
Good. That was, I think, it gave some relaxation to our eyes. Yeah.
I'll take leave.
Thank you, sir. Thanks a lot, sir. Thanks a lot. Good. So yeah, so I think we are almost 3/4 of our program. So now, yeah, a parent has spoken, a teacher has spoken, expert pediatrician has spoken. I will summarize in some time, but let's take some questions from our parent audience. If we have, they can just type in the question. We'll take that question and then we can answer that. In
They can
case
also
any of
unmute
your
themselves, but one at a time, please.
yes. Advika, okay, good. Advika has raised her hand, so maybe yeah. You can unmute Advika and you can ask. Advika, you can ask the question, or you can message the question.
I think Advika is not in the meeting now.
Oh, okay. I think she left. So anyone else has any other questions? We can take them. We can clarify them. We can, in fact, if some parent wants to share their experience, they can also share their experience. If anything, any new inputs further can have. Oh, okay. I think all the questions were the inputs given by Vivek and Ms. Gayathri were, I think, really clarified, and then Dr. Vivekanand gave excellent inputs to follow. Right. So yeah, maybe if I can ask Vivek, if he had any incident during travel with kids, it made him more aware of the travel and kind of rethink of the way he was doing. You can explain any incident.
Okay, can you hear me now? Okay, there's one incident, only one incident which comes to my mind when I talk about travel. Actually, basically, I was traveling back from Chennai to Bangalore with my kid, and I had a car seat, and there was only one mistake which I did. Was like when I started from Chennai, my kid was all right, and when on the way he started getting fever. Okay, so I was like another 5 hours or 6 hours I would be reaching Bangalore, and it was like evening 4 o'clock I started, and so at 6 o'clock 7 o'clock he started getting fever, and he was reluctant to have his food, and so I had to stop over in one place in the road on side of the road to just make sure that what is comfortable in the seat. So what happened is that was the gravest mistake which I did as a parent, and as a telling you, never stop your car when you know in places where you don't know that they are safe. And the second thing is kids don't know to lie. Okay, that's the first thing. And they when they feel sick, they really say they are sick. Okay, so please pay attention to your kids behavior, like whether getting when the temperature runs down, you know how they behave, and so you know your kids better than anybody else, even a doctor or even a so understand what they are. And immediately after coming back to Bangalore, I had to rush to Rainbow Children Hospital. Actually, it was here, and basically he was affected with pneumonia. Okay, so never take any leaves unturned. So even if you are in a distant place where you are not in nearby place where you have a hospital, please reach out to the nearest doctor and make sure that he is safe, because it's all there. As I said, be patient, and we should be all flexible during travel. That's the key for every travel. Okay, as long as if you're not flexible during travel, it's not going to help you out when you travel with kids.
Oh, wonderful,
This is
wonderful.
one
I
incident
think,
which happened.
yeah, good, good. So we have one question, I think, on parents, Zava Biniz. She has raised. Yeah, please, you can ask your question.
Yeah. Hello, doctor.
Hello.
So, like Zava is my daughter, and she's 5 years old. So we
Okay.
have given her pneumonia booster till 2.5. She was born and brought up in Bangalore itself. So,
Okay.
is it advised to take another booster during this time, like COVID time?
Okay.
So,
Yeah. Good question. So, what you're talking it is about influenza or pneumonia. Say, influenza causes pneumonia, but there is one more what we call pneumococcal booster (PCV) vaccination that usually finishes by 1.5 year. Right. That is
okay.
different. I think what you're referring is the common flu vaccine, which is being told everywhere that please get
Yes.
your flu vaccination. Right.
Yes.
Okay.
Yes.
So let me explain. See, flu vaccine, flu influenza, which was there even before COVID as well, right? That is our
Yeah.
common what we know. A child gets cold, cough, fever. One child gets, other family members also start sneezing, fever, and after 3 4 days, 1 week, all get better, right? This
Yeah.
is the thing which has been there before as well. The
Yes.
problem comes is the COVID also has same symptoms, right? So the same
Yeah.
similar kind of viral disease, although different virus, but the symptoms are again same. It starts with fever, some cough might be there, and then the child is dull, and then again it spreads in multiple family members, right? So now the
Yeah.
problem is there is no problem with the flu if the child is otherwise healthy child. There is not much of problem. But thing is now if we don't know whether it is COVID or flu which is happening,
Mm.
especially now in the flu season and
Okay.
COVID, both together are running here and there. So the
Yeah.
thing is, if you give the flu vaccine, what it does is it prevents from the flu, right?
Okay.
Especially if the child is more prone for wheezing attacks, frequent coughs, colds, and respiratory infections.
Yeah.
That this flu vaccine definitely helps to reduce the respiratory kind of infections.
Infection.
But if you're giving this flu vaccine, what happens? It reduces the incidence of flu, which sounds, which is similar to COVID. So what happens? The confusion is less. If you are able to reduce this incidence of flu, then there is no confusion, because even if a slightest fever, slightest cough, now we say, is it COVID? Should I get tested? Now, okay,
Mm.
isolate, everyone be separate, be sent to separate room. All that
Okay.
confusion will be avoided. And influenza definitely, because if somebody has influenza, right, the COVID will be
Mm-hmm.
more severe in them, right? So definitely
Oh,
this will protect in
protect.
indirect manner.
Uh,
It gives protection, definitely. Yes.
oh, thank you so much, doctor. Thank
Yeah.
you.
Thanks a lot. Thanks a lot. Okay. Anyone else has any other questions? Okay, good. So maybe I can ask Ms. Gayatri if she can explain any incident she remembers which kind of helped them to kind of reinforce their planning strategy, which they felt that, okay, because of their planning, it was safe, or anything which it made them to rethink of their strategy to travel.
As such, we did not experience any vast thing, doctor. But during trekking, when it happened for the higher grades, I got it to know from our director, ma'am, a couple of years before when they went for trekking. So a child got sprain in his leg and he was not able to go ahead. No, furthermore, and luckily they have arranged with an ambulance also. So the ambulance was ready with the doctor. So immediately the child was taken to the hospital, and whatever his need was taken immediately. So that's what. So whenever we go for trekking or something, we ensure that the basic ambulances and the needs are being arranged within a time. And when we go with a field trip, the one of the common challenges among the children is like the using the washroom. In the regular schools, we can just tell the children, you can go use a washroom and come. When it comes for the field trip, we cannot leave them alone. So if one child starts, then the other child starts. It becomes a continuous process. So even though the caretakers are there, so it becomes a challengeable thing for us. So we ensure that in the regular intervals we take them for the washrooms, and they are fine for the whole day. And the next important thing I wanted to share is we never go for water rides. We try to avoid during the field trip, especially with a huge crowd of students. we try to go for any water rides or any swimming pools. So, and the next thing I just wanted to tell is, when we go with the school, we have lots of team building activities. So there is a challenge, like if we give a chance for one child, the other child also needs the same thing to express his views and ideas. So we ensure that no the all the children gets the chance to show their skills and build the team work also. So these are the different things we noticed during the field trip, doctor.
Wow, wonderful. I think wonderful. They both, Vivek and Gayatri, are treasure trove of tips on travel experts. I think, right? It's wonderful.
Yes.
Really good. So maybe, yeah, I think if we are coming to the fag end of the session, so we heard about parents' view, teachers' view, and the pediatrician's view on how to make traveling with kids kind of safe. Maybe I can give a couple of points to use. Like for older kids, you can always have a mobile with them in case if you're traveling outside in crowds or big places, so that in case you missed track of them, you can always they can call you back and you can call them. And smaller kids, right? If they are running here and there are now nowadays available, especially the GPS tags are available, right? You use it for your luggage and suitcase, so definitely why not use it? Keep it on your kids so that you can track them just in case, right? You're not able to kind of find them here and there. That'll always help, especially in crowded places. No, it should not become like Kumbh Mela mein ghum ho gaya. That should not be a kind of any more excuse nowadays. The advent of all this technology, right? So yeah, so we're almost nearing the end of the session. Maybe I can summarize some important points what Vivek and Gayatri and Dr. Vivekanand mentioned, right? See, Vivek mentioned about many important points. So maybe I'll just couple of points I'll tell you. One is explain the trip to the child, right? It's very important. So so when you start off a trip, you explain the what is the expectation of the child and what the child can expect out of travel, and what are the limitations, right? So that the child is well prepared, right? And one more thing is wandering children, like parents busy in buying ticket or seeing on mobile, right? Keep an eye. One parent definitely has to keep an eye on the child. It's very, very important. I felt these two take home messages from Vivek's points. And yeah, definitely all others very important points, especially travel in car and all the tips he gave. Couple of points from what Ms. Gayatri mentioned, right? So she mentioned that when you're traveling in a school, especially, right, multiple kids are there. She mentioned that they plan the travel well, inform the parents, take their consent, and then ask about allergy. It's very important because I know that in the school they give all the snacks. If they know about the allergy pattern of the child, they can give appropriate snacks. That's one thing. And one more thing she mentioned that, right? See, they avoid water games. Yes, once in water, it's very unpredictable. So it's a good thing. So if any teachers are there and parents they're planning for their field trips, they can always avoid this water because it's quite unpredictable. I would like to highlight few points about from what Dr. Vivekanand mentioned, right? So he give very important, very impactful tips, especially when you're traveling with newborn, right? You travel, don't travel up to 1 month, right? So first, after 1 month only you travel, you take car seat and belt. Even Vivek mentioned, so car seat, car belt. The seat belt are very, very important. Make sure you use them and insist on the child as well. And the most important thing he mentioned, in fact, he has the experience which he could save his child, was about the Hemlick's maneuver, right? This is basically, if you're choking, you would have seen some videos. Some person was there choking, and some person comes from behind and presses on the stomach, right? We can, in fact, have a couple of one important session for parents where these techniques can be learned, right? This is not some rocket science. This is basically not only meant to be learned by the medical people. This can be learned by any bystander, especially when there is a foreign body is like eating something and choking. What to do, what not to do, right? And how you can save that persons. In fact, Dr. Vivekanand mentioned, right? This is the kind of thing. And one more thing was what he mentioned was about learning CPR, basically, right? CPR is one very important thing which the parents can learn. In fact, if it can be handy for their family members or anyone, it's easy to learn. And one more thing what he mentioned was vaccination, right? So now COVID travel, he mentioned, ask yourself, if you want to travel, if you need to travel, yes. If the answer is yes, only then you travel, and make sure all are vaccinated as fast as possible, especially the adults, and then you can travel, right? So that's about the thing what I wanted to summarize. So we have one question from Balamurali Krishna. So what is the present age recommendations for using car seat? I think the car seat which we use more, especially we don't use in the Indian setup. It's more in the Western countries. I remember that the recommendation is at least the child should be like, say, car seats. There are two things. One is having a separate seat which is in which the child will sit, and then you put that car seat and the no, like on the seat, and then facing opposite to the airbag, right? So this is basically from the infants, toddlers, I think up to if the child is able to sit comfortably, right? If the child is able to sit comfortably, then you need not use this car seat. Then the child is older enough, you can use the seat belt. But up to kids up to 3 years, 2 to 3 years, I don't know the exact thing, but I think 2 to 3 years.
Shall I reply here?
Yes,
Okay,
please.
I can reply to you in two ways. One as a parent and one as an automobile engineer who designs
great.
seats for.
Yeah,
Okay.
great.
So basically, car seats are two types actually. One is the front-facing seats and rear-facing seats. Okay. So basically, it depends on your age of the kid. Okay. Always use a rear-facing seats if your kid is less than 10 kgs. Okay, that's a thumb rule. Okay, because some kids are taller, some kids are shorter. So let's keep a thumb rule. 10 kgs less. You always use a rear facing kids. Every car seat would be equipped to be attached in two ways. One is front facing and rear facing. So the reason is always keep the car seat at the rear of the seat, and it should be diagonally opposite to the driver. So that's the thumb rule, because what happens is you can always have an eye through the rear view mirror. What happens to the kids? Many people in India car seats are very less. People don't see car seats as a safety feature here because they see it unnecessarily saves space. To be very frank, even for me, I was also thinking that, okay, when you have a small car like India where you don't have a big cars like SUVs, you don't want to block a seat with a car seat, but I would say it adds a lot of safety and a lot of convenience to your travel. The kid is also convenient. People think that if they keep the kid in the lap, it's convenient, but it's not so. Kids also face the same problem of body pain when your cars are vibrating and the cars are moving up and down on a potholes. So basically car seats isolates everything, and also it gives you comfort, and also it gives the safety of the kid. The kids are not thrown out of the seat in comes of a crash. So when your kids grow beyond 10 kgs, you can use a front facing seat. And once your kid goes beyond, like say 17 kgs, 18 kgs, I always say, please use a booster seat. Booster seat is always mandatory because you just keep it's like a very cushion at the back of below your seat, and you just strap on your kid, and your kid always feels safe in the car. And I recommend everybody, actually, I wish it soon comes up in our Indian systems, like car seat should be mandatory. They should find people who are keeping him in the lap because they're risking their kid's life.
Oh, good, really good thing, good question. And we are lucky to have an automobile engineer here to answer to the point. Wonderful. It was a good point to learn from me as well. So I think we are almost reaching 5 o'clock. I thank Aster RV Hospital for providing this platform to conduct this kind of awareness session, interactive session with parents and teachers, and have. So ultimately, the message is, when you're traveling with kids, plan well, right? Know about all these points which were discussed, and then keep it safe, right? That's the whole thing. So I thank Vivek, I thank Ms. Gayathri, and I thank Dr. Vivekanand Kushtagi for providing their inputs and sparing the valuable time on a weekend and making this session wonderful. Thanks everyone. Thanks all the parents.
Thank you, doctor. Thank you so much.
Thanks, doctor.
Thank you.
Thank you. So we'll have one more session where we'll have traveling with special kids, right? So we have kids who have medical conditions, asthma, or any medical conditions, seizures, right? So, or traveling with special kids. So we'll have another session in upcoming like next month, where we'll be discussing about the specific inputs about traveling with special kids. That's our part 2. So keep watching about this sessions, and thanks a lot. Thank you, everyone.
Thank you, doctor. Thank you, everyone. Yeah.
Thank you. Doctor, we will end the session now.
Yeah. Thank you.
Okay. Thank you for the time, everybody.